Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters comprehensive chat by the Islamic Medical Association, your Tuesday night slot. Alhamdulillah, alhamdulillah rabbil alameen, wal aqibatu lil muttaqeen, as-salatu was-salamu ala ashrafil mursaleen, Sayyidina Muhammadu wa alihi wa ashabi ajma'een. In various hadiths, the Rasulullah sallallahu alaihi wasallam has taught us and told us that those that are afflicted with either an illness or a disease, there comes a benefit with it. If you exercise some patience, there's a reward for it. If you bear through the illness, there's also a reward for it. And also, while you are ill, your du'as may be accepted more readily, and Allah is the most merciful. Tonight we will be talking about infectious diseases, and we have a specialist in infectious disease, Dr. Osman Ebrahim from the Brentis Clinic in Johannesburg. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Jazakallah khair for coming through and your valuable time. Osman, infectious diseases is such a broad subject, so obviously we're not going to be able to cover many common infectious diseases, but one that is very prevalent and something that people don't even think of it as an infectious disease because it's so rife, and we kind of experience it for a better part of the year, and that is influenza, flu. And it's probably one of the most common infectious diseases.
Absolutely. And Yakub, I'm glad that you brought up influenza, because the peak period of getting flu is actually in the first week of June. That's when it really starts. But from now, from the last week of April to May, flu is very common and it starts. So although officially the date is first week of June, we're starting with flu now. And this is the right time to talk about influenza.
Okay, so there's a lot to talk about in influenza and flu. Now, what we see commonly in our practices and generally when you meet people even at social events, they got a bit of a running nose, they got some body pain, a bit of a cough, and they say, this flu has got me down, I've got the flu. Have they got the flu, or have they got a common cold? Or do they have an allergy because we've got a high pollen count, we've got weather and seasonal changes?
Yeah.
So how do you differentiate and perhaps run through it with us?
Flu is a proper infectious disease.
Right.
Okay? So flu has got classic symptoms that needs to be there. There is a triad, which means it contains of three things. Is headache, muscle pain, and either a fever, which you must have a fever, and you may have a runny nose, you may have a cough. But the three things is fever, headache, and muscle pain must be there for us to make a diagnosis of flu.
Okay, so fever, as a doctor, you're going to measure the temperature.
Yeah.
But the patient will feel sometimes chills,
Absolutely.
hot, cold. So will that be a fever for him?
Absolutely, or her. Absolutely. I mean, absolutely. And anybody putting your hand on anyone in the house will tell you, hey, you're feeling very warm,
Okay.
you know, unusually warm, you know, and there might be a little bit of sweating as well. And the patient, you know, is got a fever, is running a fever.
Okay, so those that don't have a fever or have a temperature bordering on 38, but still have the symptoms of a cough, running nose, sore throat, a bit of a body ache, some headache, what would you say would be an approach to them? Should they go to the doctor and get tested for the flu, or should they take some over-the-counter medication?
The one thing I'm totally against, Yakub, is over-the-counter medication.
Okay.
I prefer they go to a doctor. And in big infectious diseases, a diagnosis is absolutely important. Okay. Now, I agree that in general practice, in certain areas, you can't do diagnosis on everybody. But for us, for me, for example, the first thing I would do is I would do a throat swab or a nasal swab, okay? And I would send it to the laboratory, and they would tell me what kind of flu it is, whether it is influenza A, or if it's influenza B, or if it is a respiratory syncytial virus, which is not flu, or Coxsackie virus, some other viruses, rhinitis, which causes rhinitis, your rhinovirus, different types of viruses. They will tell me that within 24 hours. Okay? But for the majority of doctors that are practicing in certain townships, practicing in more rural areas, they don't have the facilities to do that. But it doesn't mean that if we as doctors must try and establish a diagnosis before we treat anything. That is a cardinal rule in medicine, and we must do that. But over-the-counter preparations, what I don't like about over-the-counter preparation is that they're usually antihistamines. They make the patients drowsy. They're usually vitamins, which I don't think makes much difference at all, unless you are a very depleted patient. But if you are a healthy, usually healthy person, you shouldn't have any problems with that. But for me, this is the thing. But the whole hallmark of influenza is to prevent flu.
Yes. So I was going to come to that as my next question, and it's good that you brought it up. Obviously, you're referring now to the flu vaccine.
Well, flu vaccine first of all, but before we come to the flu vaccine, we need to wash our hands.
Right.
And this is something that people don't do enough.
Right.
You know? And I would suggest everybody carries a little bottle of this liquid wash in their pocket. And every time you shake hands, you know, like us Muslims, we love shaking hands, you know, quickly wash your hands, because this is the quickest way of transmitting flu, is because you put the hands close to your mouth and you get this.
It's a droplet spread.
It's droplet spread, absolutely. Yeah. That's the one thing as well. And the other thing is that a lot of people go to gym. And I rarely see people washing the equipment that they are using. This is where another place you're going to get flu.
Okay.
Okay? And it's good practice to do that. Okay? Is to prevent. Okay. Any infectious diseases, prevention is better than the cure.
And these are such useful, practical tips that you're giving.
And then
people take it for granted.
Absolutely. We take these things for granted, you know, and we must not. We must be very vigilant about this washing of hands. You know?
But as Muslims, we wash hands pretty often.
When we wudu only. And then we go on the dirty musalla, you know. So this is the important thing. But the other important, of course, is the flu vaccine. You've mentioned the flu vaccine. Yes, there's two commercially available flu vaccine. One is Influvac and one is Vaxigrip, and they contain the inactivated live virus of flu, which is influenza A, H1N1, which we will come back to that, which is the swine flu, and then they have another one which is called H3N2, which is also influenza A, and then we have the third component, which is the B, influenza B. So all these three is available in the vaccine. There is talk that they are going to be what you call a quadrivalent vaccine. A four, which is coming out soon, where they will have 2B and 2As. Okay.
So that missing B at the moment, is that causing problems?
It's not at the moment. But we don't know, as the flu season progresses, what is going to happen. That is why they're thinking of doing that. And the other thing to remember with the flu vaccine that we have now, they've tweaked it a little bit. They are not using the same vaccine that was used in the Northern Hemisphere. Because they've looked at the 2017
Northern Hemisphere flu.
No, 2017 Southern Hemisphere flu, and they've tweaked it and realized that it's not quite the same, and they are not going to use the exact vaccine that was used in Europe.
Okay, so for the viewers, in the past, the Northern Hemisphere one, the last December, their winter, used to be the one we used to get for us.
We used to get
so
for us.
it used to be just following 6 months later, 4 months later.
But now
but they've changed
They've
it.
changed
Now, this is a very important question that I need to ask you. In January, February this year, March, with the frequency of travel and people going abroad to the Northern Hemisphere, and we saw lots of people, especially that went to the Middle East and to Europe, that came back with the symptoms of flu, with the headache and the body pain and the fever, and they came back, and then obviously they had contracted the flu there, the Northern Hemisphere flu. Okay, so when we test them here, at the time, they would have one of the influenza A or B.
Absolutely.
Right, and then obviously the appropriate treatment.
Absolutely.
So then the transmission of the Northern Hemisphere flu has already taken place, or not? Yes or
not
no?
really. To transmit it on a large scale for everybody is not going to make much of a difference. It will be in that environment where they are. Absolutely. And remember, when you travel, the more likely is a respiratory syncytial virus that you acquire. You acquire it in the aeroplane, you acquire it in countries which has got different temperatures, rather than the pure flu influenza virus. Yes, but you can get influenza like that as well.
Yeah, because what happens when people do come back, they say, look, I've got the flu there, I was so sick there,
that's right.
and now I'm getting the flu again. What can you do for me? Will the medication work?
Well, the first thing is I would want to test this patient.
Right.
I would want to do a proper test. You know, I would want to see what is causing the problem.
Okay.
It might just be nothing. It might just be as a result of the travel. Okay. And if I have a diagnosis, I would treat it. Okay. Now, the treatment, there are specific treatment for influenza.
All right, we're going to come to that just now. I just want to ask you, the testing component on a large scale, practical scale. I mean, most people go over the counter to the pharmacy, or they go to the GP, people like myself, and basically very rarely it's appropriate or even practical if you've got 15, 20 patients with the same kind of symptoms who can afford the swab. So basically now you're going on gut feeling.
Absolutely. Like I said to you, the hallmark of infectious disease, you have to have a diagnosis.
Okay.
But you can't in your situation.
Right.
It's very difficult. And you have to go on a gut feeling. Okay. So a lot of the times, how do you going to treat this? You know? And you'll have to treat only the symptoms. They've got a headache, you give them something for the headache. You've got muscle pain, you give them something for the pain. You've got fever, you give something for the fever. You know? And then if they've got a runny nose, you give something for the runny nose. You give something for the cough. You know, but it's a symptomatic treatment. It's not actually treating the cause.
Yeah.
You know.
But the cause is the virus, which eventually the body
We don't know if it is the virus. We assume it is the virus.
Okay, hopefully, yeah, because there are other causes for the same symptoms,
absolutely.
like allergies and other things which we want to touch on. Yes.
Yeah.
But okay, assuming it's the virus, the body will, in most healthy individuals and the low-risk individuals, deal with it.
Absolutely. Your immune system is geared for this.
Okay.
You see? And it will do it. Within a week, within 2 weeks, it will be gone. But within a week, it is. If it is 2 weeks, then there's something really serious. Okay? Because then you have developed other infections as a result of whatever caused the initial flu.
Okay, we'll come back to the treatment and the discussion following on that after the ad break. So we'll see you shortly. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. We're discussing infectious diseases with Dr. Osman Ebrahim. We started talking about influenza, flu. The lines will be now thrown open for your questions. Dr. Ebrahim is quite keen to answer your questions. The number will appear at the bottom of the screen, so please do call in, inshallah, and any questions. It doesn't have to be a question on flu, any infectious disease that you want to talk about. He's an expert, and inshallah, he will answer your questions. But while we're waiting for that, we broke at a time when you were talking about treatment. And we're saying patients should generally, the body will work through it in the healthy individual who's not at risk. We'll talk about those just now. So bed rest or just rest is recommended.
Bed rest and rest, absolutely, Yakub.
And the role of fluids.
Fluids, you must, remember it's a virus. So the one way of excreting a virus is through the urine. So you need to get rid of it. Okay. And the second thing, the third thing, is nutrition. Eat healthy food, you know. Eat good things that are good for you, you know. You know, our mothers used to teach us about having chicken soup. Maybe it's not a bad idea to have chicken soup. Chicken. It's got the protein inside. It's got all the nutrition inside. You know, it's a good thing to have, you know. And the protein is what you need, you know, to build the body up. You know, because your muscles are been badly affected, and the protein is what you need. Absolutely.
All right. So then, there are two other groups, right? And that is the high-risk group who definitely need the vaccine before the thing. And then the other group, we want to talk about actual treatment when you get the flu.
Absolutely.
So let's start with the vaccines. We touched on it, that the vaccine is imperative, but you're going to emphasize in which groups it's absolutely mandatory that they must have the vaccine.
Well, first of all, everybody should have the vaccine. Okay. But there are certain people that is really important. First of all, is pregnant women. They must have the vaccine.
Right. Because you elaborate about the pregnancy.
Because the pregnancy, you are already immunocompromised, and you're carrying another life. So you have to protect yourself as much as possible so that the other life is not affected.
And the vaccine is safe.
And the vaccine is safe, totally safe in pregnancy. So pregnant women, very important. Diabetics, they already got a compromised immune system, so they need to be to be vaccinated. Then you've got people that have got chronic obstructive airways disease or even asthma. Prone
You're
to
referring
asthma.
to the smokers,
The smokers,
and those with emphysema
exactly.
and the asthma.
They need to have them.
Okay.
Anybody, what we call elderly. You know, elderly is a very broad term.
Yeah.
You know, but we call elderly, according to medical textbooks, greater than 65. But anybody should be vaccinated, okay? And anybody who's got an compromised immune system, like somebody who's HIV positive, for example, should be vaccinated because they are more susceptible to develop the serious complication of influenza where it can progress to pneumonia.
And the very young.
And the very young, exactly, the very young.
Okay.
Anybody, any child below the age of 5, for example, and up to teenagers, absolutely.
And the vaccine is inexpensive. It's not a costly
It's
thing.
inexpensive.
Like about 60 or 70
absolutely,
rand.
60 or 70 rand, absolutely.
And most pharmacies are now promoting it and giving it.
They give it there as well.
So they don't have to wait in long queues. And
That's right.
So, Osman, the treatment of flu. And before we go on to treatment, viewers, please, the lines are open. Do call in to Dr. Osman Ebrahim, talking about flu and infectious diseases. And we're waiting for your calls, inshallah. So we now want to go on to the treatment of flu. Influenza, once it's proven that it's influenza, either the H1N1 or the H3N2, the swine flu, there was such a big scare.
Or even influenza B.
Yeah, or influenza B.
Yeah.
And there was such a big scare a few years ago when swine flu was regarded as an epidemic. So I'm posting a few questions to you at the same time, but let's
tackle the first thing about swine flu.
Yeah, let's start
swine
with
flu H1N1 is what we call swine flu.
Yes,
it's
correct.
no longer considered the dangerous flu. It's now the normal influenza A that is around in the community, the community acquired flu. So that's what you must take out of the mind, that it is the dangerous type that we were all worried about, that you needed to be hospitalized immediately, etc., etc. So this is no longer there. But the treatment involves, first of all, to make a diagnosis that you have either got influenza A or influenza B, and you need to take a drug which tackles the virus itself. Okay, not an antibiotic, an antiviral. Okay,
right.
And the antiviral is called Tamiflu, which is oseltamivir. There's another one, Relenza, which is a different make, but is given nasally, not by a tablet. And what these drugs do, they don't actually destroy the virus. They only shorten the period that you were going to have flu. So if you were going to have flu for 5 days, it will be down to 3 days.
We got a call, Osman, so we'll continue. Assalamu alaikum.
Walaikum salam.
Go ahead with your question, sister.
Yes, I'd like to know, I got a cousin who he just turned 74, and out of the blue he had a pain in the back, but just below that, just above the spine. So now he can't bend down and pick up anything. He get a very heavy pain. What is it?
Well, first of all, I doubt if it is going to be. The pain is in the back.
Yes.
And it happens suddenly.
Suddenly, yes.
Yeah, it's very unlikely to be due to an infectious disease. This is more likely due to be most probably a mechanical a problem. Don't you agree, Yakub?
Yeah, sure. I mean, look, we need to have a lot more information, sister.
Jazakallah so much for your topic, eh?
Yeah, no problem. So you need to actually, if it's a backache, then perhaps you should consult the doctor. There are many different causes for backache.
He did take Pultaris injection. It did help him.
Okay.
But it came back again.
Now, then I think you should probably consult and find out what other causes there are. Usually with flu and infectious diseases, the muscle pain is not specific to the back only. It's a general muscle pain, you know. So he's got to have fever, headache. If he's only got a backache, then perhaps you should just consult and find out what's causing it.
You see, when he drops something down, then he can't bend down, pick it up. It gives him a very sharp pain.
Yeah, then unlikely it's an infectious disease.
To be infectious
but
disease.
So just take him to a doctor and let it get checked, and probably will need some appropriate treatment depending on whether it's muscular or something more sinister than that. Jazakallah for your call.
Assalamualaikum.
Okay, so again, people do sometimes misinterpret the muscle pain and what is it specific or generalized, and again the time limit and the time span. So you were talking about Tamiflu, the Relenza is the nasal.
Nasal.
Yeah. So how important is it to take the antiviral?
Well, first of all, the antiviral, if you got a diagnosis of flu, H1N1, H3N2 or B, I would say it is very good to take it, because it will definitely work and shorten the period that you are going to be susceptible to that virus. So that is, I would say, is imperative if we have a diagnosis. If we don't have a diagnosis, we're just going according to symptom, then symptomatic treatment is as good as anything. Nutrition, good fluid intake, etc., is as good. You don't need to go and get this drug.
Okay, one of the most common scenarios in a GP practice is the patient comes in, symptoms of a flu, that means got cough, running nose, head of fever, headache. So the flu hasn't been proven, but the patient presents like this and says, "Doctor, if you don't give me antibiotics, I don't get better. I always have to have my antibiotics." All right, so before we do that, let's speak to the caller. Assalamu alaikum. Assalamu alaikum. Okay, we'll get the caller back on the line just now. So,
yeah.
Assalamu alaikum. Okay, so Osman, the role of antibiotics, and I know you're itching to answer this question.
Well, first of all, antibiotics is not an antiviral. That's the most important. But you're absolutely right, Yakub. Everybody is programmed to ask for an antibiotic when they get a fever, when they get a headache. They feel that this is what is helping them. And over the past, they've had that, and they felt better. And they want it. Okay?
But they were going to get better anyway.
Thank you. They were going to get better anyway. All right? But it's just that the antibiotic was given at the right time for them when they were about to get better. And they got better, and they felt that this is the panacea, this is the way it is going to be. If I didn't have this, I would be sick. Okay? But what we must distinguish is that antibiotic is for bacterial infection. Now, when we were talking about certain severe cases why they need the flu vaccine, like diabetics, like your HIV patients, like pregnancy, they might develop the complications of influenza, which they will get a follicular tonsillitis, they will get an infection in the ear, an otitis media, they can develop infection in the lung. That's where the bacteria.
That's where the doctor will examine them,
and make a diagnosis, and say, this is not just quite flu. There's something more sinister. It started
like a flu, but
it's something more sinister, and that is when maybe an antibiotic would come in there. But again, if a patient is producing sputum, we would like to test that sputum. There's a lot of things that can give you infections, and we need to find out what is the cause of that infection, and that is where the antibiotic comes in. But I understand that people want the pressure, but what I would like the listeners to remember is that please don't put pressure on your doctors to give antibiotics, because the one thing we want to try and do is stop antibiotic resistance, because we are running, I must tell you, as an infectious diseases person, we're running very scared that soon we won't have antibiotics to treat very serious infection. So we must try not to abuse antibiotics. We use it, yes, if there's a place, but let's use it for the right reasons.
Yeah, so maybe you just want to explain to the viewers in the concept of resistance. What do you mean by that? Because what happens to the antibiotic?
Is like, for example, a simple antibiotic, like, for example, that everybody seems to know the name, I think is amoxicillin, isn't it, Yakub? Yeah, and amoxicillin can be used for very, very important pneumonias, especially community-acquired pneumonia. And now the patient comes into hospital to somebody like me, and we can't use this antibiotic, and we have to go for a much stronger antibiotic, because now they become resistant to those first-line drugs.
It doesn't work anymore.
It doesn't work anymore. And that's what we mean by the resistance. And that's what we want to try and prevent.
Okay, Jazakallah khair. So, Osman, anything else? Okay, we have a caller. Assalamu alaikum.
Assalamu alaikum, Dr. Essack.
Ji, how are you?
Assalamu alaikum, Dr. Osman.
So, wa alaikum salam.
Ji. Dr. I want to ask Dr. Osman is about the overuse of antibiotics. Now, what will happen in another 5, 10, 15 years' time? Will the immunity build up against this antibiotics? And the way forward?
Well, it's not like immunity that's going to be exactly what we're talking about. Resistance will build up against the antibiotics. And that is where our problem is. What are we going to do in 5 years' time if they have been abused, they've been used for nothing, for not really bacterial infections, and for periods of time which, with underdosing, the wrong doses have been used for long periods of time. All of these things will restrict our availability of antibiotics to treat serious infections. And people then that gets infections like a pneumonia or any sepsis from anything, from a diabetic or even in TB, we might have problems treating tuberculosis. So this is where the problem comes in.
Does it answer your question, brother? Jazakallah khair for your question. So that was just leading on from what we were talking about, the resistance and the availability and the overuse. You touched on one other thing which is very, very important, is you mentioned that the correct doses of antibiotics are not being used.
Yeah.
Amoxicillin is one of the most common.
Yeah.
Today, Augmentin is in great fashion also.
Yeah.
But let's touch on amoxicillin as an example. You feel that the doses, and there's this common thing now, that over the years, you've got to complete the course. So there's two questions, right?
Okay.
Yeah.
Yeah.
One is the dose.
Well, let's tackle the course thing. It has just come out.
All right, they say we'll take the ad break and
Okay,
then we'll answer
there's
this.
an ad break, okay.
Assalamu alaikum, we'll see you shortly. Assalamu alaikum wa rahmatullahi wa barakatuh. We're having a very interesting discussion and a lively one on influenza. We haven't even got to the other infectious diseases. We still are waiting for your calls, viewers. The number is at the bottom of your screen. Dr. Osman Ebrahim is our specialist today. Osman, just to take off from where we left off, we were talking about antibiotics, the misuse, and obviously it's a big topic on its own. But just two quick very valid points, and that is current now, and you just came back from a conference, is the doses of antibiotics, and again, the concept of a course of antibiotics.
Yeah. Well, we'll tackle the course of antibiotics.
You want to go to that first?
We go to the course first, because this is the most popular.
Is there such a thing as a course of antibiotics?
Everybody believes in a course. I must take it for 1 week.
Finish it.
And we must finish it. We must take it for 10 days. We must take it for 5 days. Well, this, in the latest meeting that has just come out of Spain, where the infectious diseases meeting just finished last month, and they have now said that there's no more courses of antibiotics. Antibiotics must be used for the shortest period of time and in the adequate doses possible. So, like, for example, if we're looking at amoxicillin, okay, the dose of amoxicillin is no longer the 250 milligram. It's not even longer the 500. It's now 1 gram. If we have to use
1,000 milligrams.
1,000
How many times a day?
And we'll use it twice a day. Okay, but if you want to use 1,500 milligrams, you'll use 500 3 times a day.
Yeah.
Okay, but you have to use big doses. You can no longer use the small doses of any antibiotic. It must be big doses, but for a short period of time.
Okay, we'll come back to that. We have a caller. Assalamu alaikum.
Walaikum.
Ji, sister, go ahead with your question.
My question is, I have like a postnasal drip, and I'm suffering with it for many years. I've been to the doctors, and now I've been to the specialist, and I do have the medication in front of me. I do not, when I have the flu, nothing comes up through my nose, but it goes in the back, and I have to cough it out every day. I cannot sleep, I cannot lie down because I'll be coughing throughout the night. The only reason that I sleep is that I have stomach pain and I have allergic for sleep. Or else I'll be coughing throughout the night. And I have a flu. It comes back after a couple of sneezes. It goes and it comes back. So I've been to a specialist, and they've done an X-ray on my head to see maybe I am suffering from my brain. But that didn't come out negative. So they've given me something for. They've given me nausea and
PPI.
AVAMS, and they've given me something too, like a Neolortin or something like that. So I'm on that medication for 1 month trial, but I see it hasn't helped me, and it's the same thing that's going on.
Okay, so
Maybe I didn't tell my doctor that when I sneeze, I get the flu. About a week, it goes and it comes back.
Okay, sister, well, Dr. Osman will try and answer your question. Jazakallah.
It's a very complicated case.
Yeah, it's a
Yakub.
complicated
Very
case.
complicated
Just to
case.
say she's on reflux medication.
She's on reflux
That's the
medication because that's
omeprazole
what they
that
feel
knows
is causing
yeah.
the cough.
And that's right. And then she's also on Evermus, which is your nasal spray.
Yeah.
So just go ahead.
Yeah. First of all, sister, the important thing here is that you're saying you're having the flu recurrently. Now, for me to say that you have the flu, we need to prove that you have the flu. You are a classic case where we need a microbiological diagnosis. We need the lab to say, yes, this person has got the flu or has got this particular virus. Until we have that, it's very difficult to manage.
You've got to
your
identify
situation.
the
We
germ.
have to identify the germ that is causing your problem.
Especially in your case because it's going on and it's recurring. So the fact that it's going on, recurring, it's not a simple case of just the flu. Because the flu itself is a season thing which happens every year and comes with different different strains every year. But this is send the question. She would benefit from a flu vaccine, most doubt.
Even now?
Yeah.
Absolutely, even now.
No.
You know, I would say that she's a top candidate for a flu vaccine now.
But your sister, your scenario is a little bit more complicated, it's not very simple. And like you said, you forgot to ask or tell your doctor. I think you should sit down with him or her again and go through your whole system, symptoms that you're getting, and then work through them, which one, because it sounds like you've got reflux, which is your acid that's coming up. It also sounds like you've got a chronic sinusitis.
Absolutely.
And an acute on chronic. That's why you're on the Evermus and antihistamines. And then you're probably getting what we call superimposed infections coming on top of them. So inshallah,
so we need to find out what those infections are.
Yeah, and you need to find out which infection it is, and then the appropriate. In your case, you may even need an antibiotic.
Absolutely.
Yeah.
Were you given any steroids?
Were you given prednisone? The little white tablet, though.
Very small white tablet.
Yes.
Yes, So
they're treating inflammation
also. Inflammation as well,
So you need to really go back and sit down with your doctor and go through your case. And maybe if he's not managing, perhaps you must deal with a specialist and work together, inshallah.
Absolutely.
Jazakallah khair. Okay, so you're talking about there's no such a thing as a cause. So when do you stop?
As soon as your patient feels better. They must themselves feel.
So the patient will say, my symptoms are over, I stop.
I stop. And mustn't be afraid.
Mustn't be afraid. Yeah.
You see,
okay.
that's the thing. We program patients to be afraid that hey, I didn't finish this, you know. Okay. And it's the mind. The mind is very strong. It will tell you, oh my God, you know, I haven't. That's why I'm not getting 100% better. You know.
Right, but when the doctor is prescribing Osman, he has to prescribe a certain quantity, right? He doesn't know when that treatment is going to take effect and when the symptoms will disappear. So the doctor, just for the doctors, he should still prescribe the so-called course.
Absolutely. He will say, I've given you 1 week. Okay. But, like I tell my patient, I've given you 1 week of treatment or 5 days of treatment. But as soon as you feel better, if it happens in 2 days, if it happens in, just stop.
Okay.
You know, but you're right. You can't predict when it's going to feel better.
Obviously, because everybody responds differently.
Absolutely.
And obviously, then if they don't respond adequately after that,
come and see me back.
Then they don't.
They must come back.
Right. Inshallah. Assalamu alaikum.
Hello.
Sister, go ahead with your question.
I want to know that the flu injection. Hey, how old the child gets the injection?
How old?
You're talking about the flu vaccine, sister?
Yes.
You want to know the age?
Yes.
Of who? The patient that must take it?
No, the child.
Oh, the child.
How old child can take he or he take?
How young the child must be?
Yes.
What do you prescribe?
Well, generally we start from the earliest 1 year onwards. And if they are up to the age of 3, they get 2 doses.
That's right.
The first time.
Yeah.
And then after that, the next year they will only get 1 dose.
Absolutely. What Yakub is telling you is absolutely correct. Dr. Essack, yeah.
Oh, is that?
Jazakallah khair. So, Osman, have you satisfied? You've covered the flu
I
and
think we've covered
antibiotics.
the flu quite well.
Okay.
I hope.
All right. Anybody else got questions on the flu, please do call in, or any other infectious diseases. Program time is running out, but we want to start and probably touch on another very important topic is HIV. And it's very, very prevalent. And I know you got a lot of information, Osman, being a specialist in HIV medicine. But just to set the scene for now, because we have a few questions that I think people need to know on a practical level about people that are working with them, that have contracted the disease, and they want to know how do they interact with these patients. They're on treatment. Can they share plates? Can the children play with the domestic who's HIV positive, the gardener? I just want to pose a few of those little scenarios to you.
These are very important scenarios, Yakub, and we get this all the time, okay? Because people are scared. They think that HIV is spread by just talking to someone. HIV is spread by touching someone. HIV is spread by sharing utensils. HIV is spread by sharing toilets, etc. All of this is not true, okay? The only way of getting HIV is sexual contact or blood contact. Okay, that's the two important way of getting HIV from someone. And of course, a mother who is HIV positive can pass it on to the baby. That's another story and another discussion, another scenario. But this is the important thing. Now, the problem about HIV is that if the patient is not on treatment, and the whole thing about treatment is to get this virus to become undetectable in the blood. And we can achieve that within 6 weeks to 3 months of taking ARVs. This is the most amazing thing about HIV, which people are not aware of. They think that this is the death sentence. This person is going to die. He's of no use to anybody, and I don't need to have her in my or him in my employment. It's a waste of my time. But if the person receives treatment, they are well, they are fine, they can't even transmit HIV. That is the beauty about it. And this is the whole point that the WHO is trying to achieve, is that first of all of us should know our HIV status. Okay? And I make a challenge to Yakub here that we're having the IMA meeting on the weekend that is coming. And we must ask our doctors, as soon as they register, do you know your HIV status, yes or no? We don't have to know what it is. Do you, the doctor, know his HIV? And if we, as a Muslim community, and we get to know our status, that's the best thing we can do. It's the best thing, because the WHO wants 90% of the people in the world to know their status, 90% to be on treatment, and 90% to have no virus in their blood when they take treatment. If we have achieved this, we can break the back of the HIV epidemic, because you can't transmit HIV when you have no virus in your blood.
And the affordability of the drugs, it's very, very available in all the government clinics for those that cannot afford it.
And South Africa is the best country in the world. We have the best HIV program in the world. I've come from many meetings. I've just come back from India now. I can tell you India's got a lot of HIV, and they've got the same types of HIV as South Africa, and yet they cannot reach our level of rolling out HIV in the public sector like we have done. We have 4 million people on treatment, and we are hoping to reach 6 million in 2 years' time, in 2020.
Alhamdulillah, that's good progress. So when the patient gets tested, just for information of the viewers, immediately he's treated.
Absolutely. As soon as you get tested, you get treatment.
I mean, if it's positive,
there's no more that we must do other immune tests like what we used to call the CD4, to check how far your immunity is. In the old days, and Yakub, you will remember this very well, we used to wait for the CD4 count to fall, etc. All of this is out. You have HIV, just like you have sugar diabetes, just like you have hypertension, we treat you. We don't wait. And that's the hallmark of HIV now. We treat immediately, because we need to get that virus out of your blood as quickly as possible.
Okay, we'll continue inshallah after the break. Assalamu alaikum. We'll see you shortly. Assalamu alaikum wa rahmatullah. Welcome back to the last segment of tonight's program, Infectious Diseases with Dr. Osman Ebrahim, a specialist in Johannesburg. We did the entire discussion on flu, started touching on HIV, but we had a question before the break. The caller is off the line, but hopefully listening. A caller is most likely going, from my understanding, for Umrah or Hajj. Wanted to know that she's taking yellow fever and meningitis, which are the recommended vaccines for traveling to Saudi Arabia, Makkah and Medina. Wanted to know whether he or she must take the flu vaccine, which is now available here locally. It's the Southern Hemisphere vaccine. She's traveling to the Northern Hemisphere. So she's not going to contract the Northern Hemisphere virus, or she's not going to be protected against any other virus there. But obviously, we would recommend that she must take it because she could still get the flu here.
Absolutely.
Or even get the flu when she comes back.
Or even get the flu in transit. And meeting people from the Southern Hemisphere.
Southern Hemisphere.
There's a lot of people when you go for Hajj or
So we would recommend
and I would say,
the
yes, you must take it.
Yeah, just make sure, obviously, that there's no contraindication to your vaccines. Both the flu vaccine and the yellow fever, there's a contraindication if you're allergic to eggs. So whoever you're going to will ask you that, obviously. But just double check on that. And then...
That's the good point, because we didn't tackle the allergy.
Okay.
Yeah, egg allergy is very important.
Very, very important.
And also, if you've ever developed what we call Guillain-Barré syndrome, where you get this ascending paralysis.
Just explain that, Osman.
Yeah, sometimes in the very, very, very rare, a complication of the flu vaccine is what we call a Guillain-Barré syndrome, where you get an ascending paralysis. Rising up, where you become weak. The muscles become completely weak to the level of your diaphragm, and which makes you breathe. And if that gets affected, you have to be in ICU and you have to be ventilated. But if you've ever had any problem with any weakness of muscles after taking, you should rather avoid it. This is one area where, and if you are seriously ill, you have severe sickness at the moment, you should not be taking until you feel better. Because remember, we're giving a live attenuated virus, okay? And we don't want to compromise your immune system any further.
Yeah.
So that's a very important point that we didn't tackle.
And then again, to answer that question, so we recommend the flu vaccine to everybody, irrespective of where they're traveling to, because our flu season, although it starts in June, can continue right up to end of August, early September, as the last 4 or 5 years of surveillance figures
and remember, even if you're going to the Northern Hemisphere, the components of the sun will also work for
give you partial protection.
Absolutely.
And you'll be interacting with people from different parts of the world. So we do recommend it, inshallah. Coming back to HIV, the transmission, test and treat, you can't just contract it. So when a person is on treatment and is adhering to the treatment, and
he's as well as somebody who's
and his viral load becomes undetectable in the blood.
He's as good as somebody who's not been infected.
Okay.
That is the most
So that's your take-home message for people on the HIV.
Absolutely. But now,
when we come in,
we're going to call.
Assalamu alaikum.
Hello.
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 Please go ahead with your question.
I have an infection. You see, I went to the hospital and I was diagnosed with osteomyelitis disease. It was in 1992, but all along the doctors were not telling me my disease. Then just now, it's X-ray, so that my bones are infectious. There's been torn apart, so I don't know. That's how
it's an international call. Osman, did you get the question?
No, I didn't. Actually.
Sorry, sister, could you repeat the question? Did you get the question, brother?
I didn't catch it at all.
Oh, I'm so sorry. I'm so sorry. We didn't get your question. The line was very bad. Please do call in the next few minutes if you can.
And even if we can maybe answer it at some other time as well.
Please. Otherwise, if you can just get the question to the producer, and we'll call you back and we'll answer your question, sister. We're very sorry about that. Osman, you were saying something about the HIV, that they're undetectable, but you still had some other important point.
Well, the other important point is that a person is working for you.
Right.
And you don't, first of all, you must get the person on treatment, because like we say, if they are on treatment, they are fine. But if the person that is working for you, you asked me earlier, what is the danger to the children that they are looking after, to everybody around? The question is, if the patient is hasn't taken his treatment properly, is now contracting tuberculosis. That is where the danger is because TB can be spread by droplet infection. Okay, so just talking to someone working in the same
Very
environment
infectious.
is very infectious.
Yeah, right.
So this is where the danger would be, especially if the person has contracted tuberculosis and is looking after small children. That is where it is. So going to the next infectious disease is tuberculosis.
Right. I'm going to interrupt you then to ask you now, in the state, and even in your practice, is it standard protocol that everyone that's HIV positive will be tested for TB immediately or
No.
not? Do you wait for symptoms?
We wait for symptoms,
Okay.
absolutely, because what do you test for TB?
Yeah. No, I'm
Okay,
posing the question.
you can't. In HIV, the so-called MAN2 test
And
is not.
TB.
Yeah,
Yeah.
but
The
if
MAN2
somebody is
test,
HIV
yeah.
positive, the MAN2 test means nothing.
The skin prick test is meaningless.
It's meaningless.
Okay.
There's no real blood test for HIV.
So what is
Although
this gold test that the doctors
the
are
gold
doing?
test that our doctors are doing is measures what we call a protein in the blood called interferon gamma. Okay, but now interferon gamma is also released when you have HIV infection, so you can get a false positive.
Okay.
And you think, and it's measuring basically for latent or active TB, but it still tells you, that's all it's going to tell you. The person has got latent TB, which means TB which is dormant, or he's got active TB, but you can't distinguish between the two. So you would have to do more tests. That's all it tells you, that
Okay,
TB
we
gold.
almost run out of time, Osman, but just one quick message as far as the risk of TB with HIV. So they're going to wait for symptoms, and when the symptoms come, they must test immediately for TB.
Absolutely, and the symptoms of TB is well known.
Okay.
You lose weight, you lose appetite, you have a fever, and the most important is you have severe night sweats. There's no other illness that gives you night sweats like tuberculosis does. So it's quite easy to know that something is really wrong. Go and see your doctor immediately, have a chest x-ray, have some more tests done, your sputum, etc., and get treated for TB, because that's another disease that is fully curable, fully curable if you take your medications properly.
And people mustn't feel that they're comfortable wherever they're living, that the TB is only in the low socioeconomic areas.
Believe me,
in
I've seen
overcrowded
many
areas.
doctors getting TB. I've seen many people that are athletes getting
because
TB.
it's so highly
because
transmissible.
it is so highly transmissible.
Okay, that is the take-home message as far as the TB goes. There was a lot of good, positive information from Dr. Osman Ebrahim. Jazakallah khair for coming. We're going to bring you
pleasure,
back again.
Yakub. And
because
inshallah,
we've
we've
got a lot
got
more
lots of
questions
things to talk about, yeah.
inshallah. And to the
Inshallah.
viewers, Jazakallah for listening in.
And thank you, yeah.
Assalamu alaikum wa rahmatullahi wa barakatuh.